Good morning and welcome to the Caregiver Teleconnection. My name is Glenda Rogers and I'm going to be your facilitator for today's session. Today we have with us Lucy Barylak and Dr. Elliot Sklar, and they're going to be talking about caring for someone with mental health issues, a very important topic. Before they get started, let me tell you just a little bit about Lucy and Elliot. Lucy Barylak has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She has been involved in various research projects and has published numerous articles related to caregiving issues. She has lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy is also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and clinics in Texas. Lucy would also like you to know that she was a caregiver for her mother for about 10 years. Dr. Elliot Sklar is a public health professional focused on supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, Florida, and virtually. Dr. Sklar is an associate professor of healthcare sciences at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. Welcome, Lucy and Elliot. We're so glad you're with us today.
Thank you so much, Glenda and Minerva. Good morning, everyone, and welcome. Well, May is Mental Health Awareness Month, which has been observed in the United States since 1949. We've been paying more attention to mental health in recent years, and especially during and since the pandemic. Data shows that we have an increase in anxiety, depression, addiction, and other mental health issues. We may not even realize that we live or care for someone with mental health issues. We've sensitized this subject and welcome your comments and questions today. Please feel free to remain anonymous and stay with us after our program for 30 minutes. Unstructured a discussion could be had, and we are going to close the recording. So let's start. Mental illness, also called mental health disorder, refers to a wide range of mental health conditions that affect your mood, thinking, and behavior. Examples of mental illness include depression, anxiety disorders, schizophrenia, eating disorders, and addictive behavior. One of the first challenges many caregivers and patients experience can be diagnosis, and many patients are reluctant to seek care. Unfortunately, there's still a big stigma in our population regarding mental health disorders. So how do we determine a diagnosis and check for related complications? So one of the things is you could have a physical exam. Your doctor will try to rule out physical problems that could cause your symptoms. There could be lab tests. These may include, for example, a check for your thyroid functioning or screening for alcohol and drugs. A psychological evaluation. A doctor or mental health professional talks to you about your symptom, thoughts, feelings, and behavior patterns. You may be asked to fill out a questionnaire to help answer those questions. What's very important is to be extremely honest, okay, to be able to get a good diagnosis. Sometimes it's difficult to find out which mental illness may be causing your symptoms, but taking the time and effort to get an accurate diagnosis will help determine the appropriate treatment. The more information you have, the more will be prepared to work with your mental health professional in understanding what your symptoms may represent. And this is also true if you are a caregiver to someone experiencing mental illness. You know, it's just as important for an older person with symptoms of depression to seek treatment as it is for someone younger. The impact of depression on health in older adults can be really severe. Much research has responded that depression is associated with worse health in people with conditions like heart disease, diabetes, and strokes. Depression can complicate the treatment for those conditions, including making it difficult for someone to care for themselves or for others and to seek treatment when needed. In older adults, depression may be looked at as frailty, or it may be viewed a result of life changes, chronic illness, or disability. Recognizing the signs and seeing a healthcare practitioner is the first step to getting treatment, which can make a real difference in someone's quality of life. So never be embarrassed or afraid. It's very important to get a good diagnosis.
Absolutely. And many people don't realize actually how common mental health issues are. The CDC's most recent data is from 2020, and their report stated that about 20% of adults had received mental health treatment in the past 12 months. That includes 16.5% who had taken prescription medication for their mental health, and 10% who had received counseling or therapy from a mental health professional. Women were more likely than men to have received mental health treatment. Are we surprised? We're all avoidant in terms of seeking out help for our mental health, but men particularly more so than women. And there's a lot of data to support that. The National Institute on Mental Health in 2021 reported that mental illnesses were common in the United States. And per their report, it is estimated that more than 1 in 5 adults live with a mental illness. So that's about 58 million in 2021, which is up from the CDC's report in 2020 of about 41.7 million. So this means that more people are getting diagnosed with different kinds of mental illnesses. People are really surprised to learn that the rate of mental health disorders are rising quickly among baby boomers. It's estimated actually that about 20% of people 55 or older experience some type of mental health issue, and that the number of older adults with depression is expected to double between 2010 and 2030. So we're not that far away from 2030, and when that projection was made, the pandemic was not a factor. So we go through a lot of changes as we age. For example, death of loved ones, medical problems, retirement, which can be very challenging for people and make you sort of have more time on your hands. And what's that old saying, idle hands? But that can make people feel uneasy, stressed, sometimes even sad. Social isolation or the stress of acting as a caregiver can also negatively affect older adults' mental health. Now, it's normal to go through an adjustment period after any kind of major life event, including the act of caregiving. But if the feelings persist and begin interfering with daily life and normal functioning, and I think that's really the key, that's when you know that it's time to seek out treatment so that you can feel better. Unfortunately, a lot of older adults are hesitant to reach out for help due to the stigma that Lucy was just talking about around mental health. And there are a lot of generational differences in how these disorders are perceived. You know, a lot of people in the old days used to think that you needed to just stick it out or tough it up, buck up. That's not how people feel anymore. And this is actually one of the reasons why suicide risk is highest among older white men, more than any other group. And aside from all of the data we know, and I'm sure many of you participating know, mental health issues are often underdiagnosed and underreported. So those statistics I was talking about, there's likely a lot more mental health issues than just that. So for our program, we use the broad term mental health issues because caring for someone with mental health illness can vary tremendously. You may know someone who's being treated for depression and who usually seems fine, but might be going through a depressive episode. For other people suffering from depression, their experience might be very different. And conversely, you may have seen a change in mood or the affect of a loved one during the course of the pandemic, following it. Another hallmark of people who experience mental health issues is cycling on and off of medication. And that can be a wild ride for the person and people around that person. So I like to think of depression or anxiety like allergies. Sometimes pollen and seasonal allergies can trigger my allergies, and I might need some medication or eye drops. And at other times, I'm okay. For other people, their allergies might be more severe or consistent, like people with asthma who are allergic to dust, which is pretty much everywhere. It helps to remind me that during more stressful times, someone who suffers from anxiety and depression, for example, might have more challenge in their ability to cope in a healthy way. And sometimes the inverse is true. People who are depressed have a harder time during things that we consider to be celebratory, like Christmas or New Year's holidays, or just recently Mother's Day. It can also be very challenging to love and to care for someone with a mental health issue, and we hear this from caregivers because of simply the challenges that are inherent with mental illness. You know, a bad knee might impact someone's mobility, okay? But poor mental health can affect everything, including a person's desire to even be mobile. So if you think about it, many caregivers themselves have had periods of challenge. And as a result, that impacted relationships that they had around the caregiver. I know some caregivers who've used alcohol to cope, for example, and that had an impact then on their other relationships. So one of the most difficult things about mental health issues is the stigma, again, that comes with it. We see mental illness and mental health sometimes as a weakness or a failure, even a lack of motivation. And really that needs to change. One of the statistics that is most alarming to me is that about 60% of older adults who die by suicide have seen their primary care practitioner within the last month of their life. And that means that PCPs are not attuned to the mental health of their patients. Last year, just as an example, we lost a national treasure, a senior, Naomi Judd. And it was released that she had committed suicide. And before her death, she had been very open about her struggles with mental health, particularly depression and suicidal ideation. And her daughters had attributed her passing to the disease of mental illness. It's not something that we commonly use to attribute as a cause of death. And I think that, you know, it's a reminder that mental health issues really can affect anyone. And some elderly adults may face uniquely high risks for developing mental illness like depression. Part of that is due, I think, to the link between a lot of health conditions that people have and depression. People who have chronic health concerns like diabetes or heart disease or even living with chronic pain are also more likely to have certain mental health conditions like depression, for example. Older adults that tend to have more health concerns, with 80% dealing with at least one or more chronic condition, according to the CDC. So it would make sense that there's a correlation there between depression and the experience of these chronic illnesses. In addition, there's a lot of loss as we age. I was with a relative of mine last week who's 92, and we went for lunch, and she was telling me that she only has one friend who's left alive, and that friend is 99 and in the hospital. And she said, if she goes, you know, and chances are at 99, it's not looking so good, that means I have no one left. And it really touched me because I'm very sensitive to the isolation and loss that she has experienced in the last few years, with many of her friends passing away. So it is important to know that there are effective treatments out there. And sometimes, again, all it takes is an honest conversation. That's why we're here. And that's why we're going to have an unrecorded extension to our program today, as Lucy said, a discussion of 30 minutes. But it can be very hard for caregivers who are concerned about suicide risk among their care recipients. And I want to remind everyone of the 988 crisis hotline that now exists both by text and by phone to help you navigate through difficult moments, because we all need a resource. So I wanted to ask, since this is a good time for honest conversation, if anyone had any comments, any questions, or any experiences that they wanted to share.
All you have to do is to unmute your microphone, and I will call on you by your name. The chat box will remain open if you have questions or comments you'd like to put there you're welcome to do that also.
I know it's a heavy topic.
Yes, it is. People don't realize it. They don't feel, if you have something like a heart condition, it's okay to talk about it. But if there's something mental health, you kind of feel apprehensive. I see that there is something on
Yeah.
chat.
Diane said that my dad has Parkinson's and repeatedly wants to do assisted suicide.
Wow.
So my question, Diane, if you feel comfortable entering it in the chat box, is how does that make you feel? Because that must be a very hard thing to grapple with. Anouk says sorry.
Yeah. Well, I have to say, in the later stages of my own mother's life, she would tell me that she really wants to die, that she's had enough. It's very hard for anyone to accept that, especially for an adult child to hear that.
And Diane said it's extremely hard, which I can only imagine. I think if we step away from the relationship of child and parent, rationally, I think at times we can appreciate that person's wish or decision. But it's so challenging when that becomes incumbent upon you as a child.
For sure. We can talk a little bit more about it if anybody wants to stay on later on. It's something we could discuss. Thank you for that, Diane. Okay, I'm just waiting to see if there's anybody else, but if not, I'll just continue. This may be repetitive for some of you, but it's important to discuss and define mental illness and the type of mental illness we're discussing today. The defining symptoms for each mental illness are detailed in the Diagnostic and Statistical Manual of the Mental Disorder. It's called the DSM-5, published by the American Psychiatric Association. This manual is used by mental health professionals to diagnose mental conditions and by insurance companies to reimburse for treatment. One of the challenges is that these diagnoses often don't have the kinds of tests we do. For example, if we have cholesterol, you go for a blood test, you get medications. But there is no blood test at present to measure depression. That can make diagnosis and treatment more challenging, since it's up to the patients to be candid when disclosing symptoms. It's up to the provider to use their expertise and the judgment. So it is difficult, but the main classes of mental illness relevant for our program today are, so we're going to talk about these specific ones. Depressive disorders, all right? These include disorders that affect how you feel emotionally, such as the level of sadness or happiness, and they can disrupt your ability to function. Then we're going to talk about anxiety disorders. Anxiety is an emotion characterized by the anticipation of future danger or misfortune, along with excessive worrying. It can include behavior aimed at avoiding situations that can cause anxiety. This class includes generalized anxiety disorder, panic disorder, and phobias. Now we're going to talk about trauma and stress-related disorders. There are adjustment disorders in which a person has trouble coping during or after a stressful event. Examples include post-traumatic stress disorders, PTSD, and acute stress disorders. Now, substance-related and addictive disorders. These include problems associated with the excess use of alcohol, tobacco, and drugs. This class also can include gambling disorders, shopping, and sex addiction. Neurocognitive disorders, they affect our ability to think and reason. These cognitive problems include delirium as well as neurocognitive disorders due to conditions or diseases such as traumatic brain injury or Alzheimer's disease. Personal disorders, okay? It involves a lasting pattern of emotional instability and unhealthy behavior that causes problems in your life and relationships. That includes borderline, antisocial, and narcissistic personal disorders. There are many types of mental illness, but we thought it was important to outline the key disorders we'll be discussing today that a lot of people are facing. And it's so important that you identify those if you're feeling those feelings that you might be having a mental health problem.
And again, we are going to have an extended 30 minutes after our program today. We really hope people will stay on with us. We're here just to talk and to provide you with a forum. So I do want to talk about treatment. Talking is one of them. That's why I brought up our discussion. But treatment really does depend on the type of mental illness that a person is diagnosed with, its severity. And I also really firmly believe in what works best for you. Now, in many cases, a combination of treatment works best. We know this. Talk therapy is very important. Medication on its own is not as effective. If you have a mild mental illness with well-controlled symptoms, treatment from your primary care provider may be sufficient for prescribing a medication. But a team approach can be very helpful to make sure that all of your psychiatric, medical, and social needs are met. And this is even more important for severe mental illnesses, such as cases of schizophrenia, for example. Now, treatment might include a family or primary care doctor or a PA, a psychiatrist, for example. There are also geriatric psychiatrists who specialize in medication management among seniors, which is very important because medication doesn't work the same way for different populations, like teens or the elderly. So a psychotherapist or counselor or social worker might also be involved for talk therapy, which is important. And the extended family might also be involved to help support that person to help manage medication. As I was mentioning earlier, a lot of people cycle on and off of their meds, which can be very challenging because as soon as you start to feel better, you question why you need a medication. But psychiatric medications alone do not cure mental illness. They significantly can improve symptoms. Psychiatric medications can also make other treatments like psychotherapy, talk therapy, more effective. Now, the best prescription medications will depend on your particular situation and how your body responds to a medication. Some of the most commonly used classes of prescription psychiatric medications include antidepressants, which are used to treat depression, anxiety, and some other conditions. They can improve feelings of hopelessness, sadness, lack of energy, difficulty concentrating. Antidepressants are not addictive. They do not cause dependency. But sometimes it's very hard to know if someone is on the right medication. And as an example, Diane and I were chatting and she had shared that her father is on medication for depression because he has expressed suicidal ideation. And it's very challenging, especially when medication might not be working. And if you have watched television or seen commercials on TV, a very big thing for antidepressants right now are adjunctive therapies, which are additional complementary medications used in combination with something that someone is already on because of sometimes what's called antidepressant poop out. Because after an extended period of time, people sometimes feel that their medication isn't as effective as it once was. And people are finding now through research that increasing dosage when that happens is not always the best answer. So there are these medications that you can use now in conjunction. There are also anti-anxiety medications, which are sometimes used to treat the generalized anxiety that Lucy was speaking about, or panic disorder. They can also help to reduce agitation and insomnia. There are long-term antidepressants or anti-anxiety rather drugs that work. Some antidepressants work for anxiety, but there are also short-term relief fast-acting anti-anxiety drugs that many of us have heard about. I'm sure Xanax and Ativan, Klonopin, and so on. And they can cause dependency. So it's very important that these are used in the short term. There are mood stabilizing medications, and these are usually used to treat bipolar disorder. They can sometimes involve alternating episodes of mania and depression. So these medications are most used to treat those kinds of symptoms. And finally, antipsychotic medications. These are used to treat more severe mental health issues like schizophrenia. They may also be used to treat people with bipolar disorder or depression. What we've seen is that across the board, sometimes these medications are used more widely than necessarily their intended or originally intended use. So medications are very helpful, but they're only helpful when people stay on them. And a lot of these medications do have significant side effects. On the other hand, some are more mild. So I think one of the keys for successful treatment is open and honest communication with the provider. Because if you're having issues adapting or adjusting to a medication, the more honest you are about that, the more likely you will be to continue on a medication that is most successful for you. And it can be very, very challenging to care for someone who is suffering from a mental health episode, or to bear with them as they adjust to a medication, which can impact mood, sexual function, which is important for couples, weight, and other behavior. Sleep, for example. One of the frustrations of science, I think, at the moment is really a lack of new approaches to treat mental illness. And as I was saying, there haven't been very many new antidepressants to enter the market. There have been new adjunctive therapies. There are some newer therapies that are just now emerging, like ketamine and also repetitive transcranial magnetic stimulation. I know that's a lot of jargon, and I'm not sure that anyone has heard of this, but it's a non-invasive technique that is provided on an outpatient basis, covered by some insurance plans, not all. It's very expensive. It delivers magnetic pulses to the brain that stimulate nerve cells that influence mood and depression. And there are studies that suggest that this is a safe and effective treatment for people who have not gotten better with other forms of treatment. But as I said, it can be extremely expensive. And while it is a brief treatment, you do need to go every day for a couple of weeks. So it does require a time commitment. But there are a bunch of these clinics popping up because this is an increasingly common new type of treatment. So I see we have, I thought we had some questions in the chat. Does anyone have any questions about anything that I've presented so far or this new type of treatment? Okay.
Well, I have to say that's very, very interesting, Elliot, and I truly hope that there's a lot of good follow-up with that. It's been a long time since something new has come up. And I just want to point out that there's other ways of also medications are very important, but Elliot and I are always saying how important exercise is, eating well and sleeping well. And we can talk about that a little bit more if anybody wants to later on. You know, this is especially why learning about the illness can help you understand how it affects the person you care for and might make you feel more confidence caring for them. Now, it's really hard to be a caregiver for someone who has mental health issues. You know, you can learn more about the illness by going to support groups and services. So find out as much as you can about the symptom that the person you're caring for. You know, you can meet others who may have been through similar experience and get support and information. It can also be a safe place to express anger and resentment, which I can thoroughly understand, which is also a goal of our program today. It can be hard to care for someone with mental illness, which can impact your interaction and how the person behaves. So the question is, how do you give emotional support to the person that you care for? I think one of the most important things is offer to listen to the person you are supporting. Listening to someone doesn't mean you have to say much back to them or come up with solutions to their issues. Okay, keep that in mind. Sometimes they may find it helpful to just talk to you about their problems and to know that you are there to listen. Don't be afraid to ask questions if you want to, but ask them about how they are feeling and listen to their answers. If they aren't feeling great, ask if you can do anything to help. Make sure you don't take on too much and become overwhelmed yourself. The other question is, so how do I encourage the person that I care for to get treatment? And a lot of times you might find that the person is not, that you want to help doesn't want treatment. This might be because they don't think they need help and things will get better on their own. That's what they might be telling you. They don't think treatment will work. They don't understand why they are unwell. They're scared of what will happen to them if they tell their doctor and how they feel. They might be worried about other people might think about them, that stigma that we talked about. They're worried that it will affect their job or studies, and I can certainly understand that. Feeling hopeless and are reluctant because of past experience that they may have had with the doctor that they talked to, and the person didn't do anything or couldn't understand exactly what they were going through. So if the person you're caring for doesn't want to get help, it can be very, very frustrating. So if someone you care for doesn't want to get that help, this is what you can try. Talk to them about how they feel. Ask them why they don't want to get help. Don't argue with them. Don't challenge them. Explain that you are worried because they seem upset, down, depressed, and you want to try to help them. Explain what kind of help they can get out there. So educate yourself on what is available so that you can share that with them. Offer to help them talk to their doctor or offer to talk to their doctor before the appointment, obviously with their permission. Some people might refuse to get help if you try to support them. It is important not to give up and to stay hopeful. So maybe in the beginning, they won't want to accept any of that. It might take a while before they actually get help. So it is a difficult thing. So I kind of want to open it up a little bit. Does anyone have any questions or experience to share? Has it been hard for you or your loved one to get help that you need? So we can open it up a little bit. I see there were some things on the chat, Elliot, if you can help me with that.
Yes, Maria had shared that her husband was against meds until about 4 weeks ago. He heard his daughters tell him that he had changed in the past year. He was diagnosed with PTSD and now seeing counseling, and how he has dissociated in life. He is a veteran, and Maria is now learning about all of this, and it's very difficult. So I had said that I'm really glad he's getting the help that he needs. And Dorothy had shared that sometimes people are embarrassed or afraid of what people will think. And I think that is so true. And I think that's really the biggest barrier for many people to get the help that they really need. And that's why, again, I want to remind everyone, we now do have a mental health hotline that is 988. You can call from any phone, completely free and anonymous. It's a great way to be able to at least link up with a counselor, even just initially, and see if it's helpful.
With other sessions that we've had, healthcare providers in the healthcare field many times feel a lot of these feelings of depression and anxiety, and some of them are afraid to go and speak to their superiors about the condition. But it's so important to be able to identify it and not to keep it inside of you, and to be able to go and get the help that you need. So very important. And if in your life you see someone that's struggling, might not necessarily be someone that you're caring for, it could be a friend, a relative, to just be patient, to listen, as I was saying, that you don't have to come with solutions, but just to listen to them and let them know that you're there for them. That is so important for people to feel that they are not alone in what they're going through.
Absolutely. There's actually a great series of videos online now made by healthcare providers who are experiencing stress, anxiety, PTSD from the point of crisis with COVID. And they're talking about their own experiences with counseling and medication. It's very refreshing because there is stigma among healthcare workers as well. And we do here have some tips for healthcare workers specifically because we know that in our programs, we do have a number of healthcare workers who participate. We have some additional tips here on how to broach the subject of mental illness or concerns you might have with patients. And this might be useful also for caregivers. And the first is to show that you're concerned in a way that is non-judgmental and not confrontational. So a really good example is, you seem blue and it upsets me to see you this way. How can I help? So that sounds very much akin to what Maria's daughters were sharing with her husband. And that was helpful in prompting him to get help. What can we do to make it better? Keep questions simple. We have here the Patient Health Questionnaire, the PHQ-9. It's a tool that's very helpful. It's available free online on the internet, and they even have ones that are self-scoring. It's a good tool to help assess where people are at, even just as a reflective measure. It's great to offer reassurance and hope, and it's important to avoid phrases that could sound dismissive or accusatory, because although you might not necessarily understand what someone is feeling, it's important to express unwavering support, and also to suggest reaching out to a local organization for help if needed. Again, remember that 211 in your local community is a great resource for finding assistance. 988. And in the past, we've also talked about a website called 7 Cups, which is the world's largest free online support group. So these are important considerations because this way people can access what they might need anonymously from home. And that's important in helping to bridge some potential cultural barriers that exist. We keep talking about stigma, and stigma exists more so in certain communities than others. Well, for example, African Americans and Hispanic Americans use mental health service treatment about 1/2 the rate of Caucasian Americans, and Asian Americans at about 1/3 the rate. So we know that people underutilize mental health care services, but that is even greater within some communities. And there are generational differences, as I was saying earlier, too. The most important thing that I can say is after your initial conversation, stay engaged with that person and check in with them. That is the thing that makes the biggest difference because people are alone and isolated very often. And that's why there are, telephone check-in programs and so on, visiting programs, for example, for isolated seniors. And the one tip that I learned early on is that if you are concerned about suicide, ask a person what their plans are for the weekend or what they plan to have for dinner. Simple questions like that are questions that ask about the future can be helpful because if a person is really imminently suicidal, they don't make future plans. So that can be a helpful quick tool. We did have a chat here from Laura. My loved one has been experiencing major depression for several years. He refuses any help and won't leave the house. The depression is causing his inability to get help. It's a cycle he is stuck in, and I don't know how to help him get out of it. It's a very great question, and I think a challenge that many people experience. Lucy, do you have any tips?
Well, it's extremely difficult if someone doesn't want to get help or someone doesn't recognize that they need support and help. In many cases like that, the only way that I could see approaching it is, first of all, I'm so glad that you're on this call today because you're trying to get the support. I think for you, especially, if you could join a support group or go for counseling, because you cannot take the ownership upon yourself. This person may never want to accept help. It's really more about you and how you deal and accept living with this person under these conditions, and not take it upon yourself that you're going to heal or that you're going to be able to help him. So that's what I would sort of focus on more of that. How do you move forward, knowing that this individual does not want to accept help? Is it tolerable for you? What is your quality of life? What do you need to do to make this situation bearable? These are questions that you really should be asking yourself with the help and support of either an individual counseling or in a support group where you can share it. So I'm not trying to avoid it, but I'm just trying to tell you right now, it's about you more than anything else. I don't know, Elliot, if you have any other suggestion, but that's where I would go. And thank you for sharing.
I was shaking my head the whole time because my response would be identical to what you just said. Laura, it's most important that you get the help that you need. If this has been going on for years, and I understand it's like being in quicksand, it's hard to get out of for your loved one, you need to figure out how you are coping, because it is challenging when people refuse to get help. I wonder what his barriers are that are making him so resistant. If it is simply the depression itself, sometimes it's more than just that. And in addition, I'm sure that this has a tremendous impact upon you. And I hope that he recognizes that potentially as a motivator to help him get there, just as Maria shared with her family experience. I am sensitive to the time, so I'm going to move along. I wanted to speak personally because I do have experience living with and caring for someone who suffers from mental illness, and it can be very challenging at times. It's really important to remind yourself that the person you're caring for has an illness, and that their behavior or their reactions are a symptom of that illness. Sometimes it's not always easy when you're around that person to stay calm and rational, or not to take things personally or be triggered. And I think that for me was very challenging. Looking after yourself emotionally, if you care for someone with a mental illness, can be very stressful and difficult. And it's important to look after your own health and well-being. You can try some of the following things, like exercise, and we always recommend counseling, knowing when you need to take a break. We heard from a caregiver yesterday who felt very badly about blowing up on their care recipient because they just reached a point of such frustration. The best thing you can do in moments like that is to walk away, to take a break, to go to the bathroom. Diffusing the situation is so important. And again, keeping physically active helps our mental health. It boosts all the things that we need. Same holds true for having a well-balanced diet, and also for setting boundaries. There are things that we can and that we cannot do. One of them might be that we cannot get our loved one to get the help that they need. So we need to figure out what our boundaries then are and what we're willing to accept or not. And that can be hard, and that's why it is so important to work with a counselor. So I think, I call these things acts of self-preservation, because when I'm around someone who's struggling with their mental health, for me, I make it a point to go out for walks. It's my way of maintaining my sanity and also my balance. So does anyone have any other tips of how they maintain their own well-being and mental health when caring for someone? Laura said that she has been working on these things and can keep going in that direction. And we're glad to hear that.
100%, yes.
All right, let's keep moving.
Sure. So we receive emails from caregivers. We wanted to share a few of them with you today. My husband and I have been married for over 40 years. Mike has had to deal with mental health issues throughout our marriage. In the past, it has been manageable with medication and his willingness to see his doctor on a regular basis. The problem is that Mike has been diagnosed with early dementia and his mental health issues have escalated. He's more depressed, anxious, and at times difficult to manage. He's still followed by his doctor. What can I do to help Mike on a daily basis? Well, first of all, I always want to thank you for your question. I'm glad to hear that he's followed by his doctor. But my question is, when was the last time he was seen by the doctor? The fact that he is more depressed, anxious, and difficult to manage, I would want to know more about those difficulties that you are experiencing. Does he become verbally or physically aggressive towards you? This is important for you to keep in mind. But I think it is important to please make an appointment with the doctor and write down all the behavior that he is displaying. He may need to have his medications changed or increased or decreased because he has, I'm not sure if he's on any medications for his cognitive functioning. So there's very many issues there as well. And as I always tell caregivers, you need support at this time. Things are changing. And so it is very important to see what is going on. The other thing is, what I would like to tell you is, please don't argue with him or challenge him when he is displaying these behaviors. So if I know a little bit more, I could be a little bit more constructive in what I'm trying to tell you that you need to do. But I do believe that he should go see the doctor and write everything down and get the support that you need.
Absolutely. Whoops. Sorry. I'm again being mindful of time. So I do want to share some resources here. And again, we always provide a copy of our handout, our slides as a handout here for everyone that participates. But a common concern for many caregivers of individuals who experience a mental illness is, how do I deal with a crisis situation? And it's important to plan for crisis situations so that you know who you might contact and what you might need to do. So make a personal plan that has information about, signs of a crisis and what to do if it happens. A crisis situation can look very different in different circumstances and scenarios. Speak with your healthcare provider or your loved one's healthcare provider. Get the support that you might need. That was also why I had asked Diane if her dad's physicians were aware of his suicidal requests, because this is very important. So we do have some resources here for confidential 24/7 hotlines, which I think are very helpful, because for people especially who are resistant or reluctant to accept help, a hotline can sort of be an introduction or a little sampling of what counseling can be like. There is, again, that 988 suicide and crisis hotline that we have now. And that has been a great resource for people. You can text them as well. I can't underscore enough that there are resources out there. You can get telehealth counseling online now. There's just more resources out there than ever before. So if someone that you love has been reluctant to get help, perhaps a video session in the home might be helpful. There are all kinds of options. And again, as Lucy and I have said, sometimes if you can't get someone to get help, make sure that you get the help that you need. Lucy, I know that we have one more question here. I'm not sure if you want to go through it quickly.
Okay, I'm a caregiver for my wife who's had many strokes in the past. It has affected her, excuse me, cognitively as well as physically. I help her with all her daily activities. I suffer from mental health issues, and I recently started to drink more often. I'm not sure what is going on and would appreciate knowing if I'm heading in the wrong direction. The question is, what should I do? This is becoming very difficult to handle. I have to say that it takes a lot of courage and insight to acknowledge what you're going through. So thank you for reaching out. What you need to make is, and again, I believe that is to make an appointment with your doctor. I'm not sure if you are taking any medications now, or if you stop taking the medication, replacing it by the alcohol. If not, you may need to get a new prescription. Drinking may be your way of dealing with difficult situation that you are experiencing right now. And I want to say that I do believe that you do need help and support. You don't need to do this on your own. And as Elliot and I were saying, Elliot just pointed out to all these amazing lines, helplines that you can call to, or there's resources in your community. Thank you for that, Elliot, that you can get in touch with, speak to a social worker. But if you are drinking now and you might be heading in the wrong direction, yes, but thank you so much for having the insight to see that there is a problem. That's the first step to getting help. And I wish you all the very best. And if you are on the line, please remain and join us for the half hour.
So we'll hand it over to you, Glenda, to share information about upcoming programs. And again, I'm sorry, go ahead.
Go ahead, Elliot.
We will then take a short 2-3 minute break so everyone can use the restroom, and then we'll regroup. We will stop the recording. You can change your name on Zoom to be anonymous if you'd like, and we'll have a completely unstructured 30 minutes together.
Oh, that's going to be really helpful to many. I think Lucy and Elliot. Let me tell you just a little bit of what's going on in the Caregiver Teleconnection for the rest of the month, because we're just zooming right on till the end of the month. This afternoon at noon, as a matter of fact, about an hour from now, Dr. Natalie Oliver, who is one of our frequent presenters and who I appreciate so much, is going to be talking about aging and sexual expression. So that's an interesting topic if you want to tune in today at noon. I'll be back with you on Tuesday with Evelyn Greb, and that's at 11 o'clock Central Time. And she's going to be talking about coping with the caregiver role. All of these topics are so good. And I want to remind you to go to our website, which I've posted early on in the chat box, and look for the podcast of a lot of these sessions. We've been putting podcasts up for many years now. So I think you'll find sessions that will be helpful to you in your caregiving role. And then Elliot and Lucy will be back, and I'll be with them. I'm so glad about that. Next Thursday, May the 25th at 10 o'clock Central Time. We're going to be talking about disaster preparedness for caregivers. It's that time of year. I think Elliot would say that. We're zooming into hurricane season. And tornadoes seem to always be with us. And so I'm looking forward to that session as well. Any other questions or comments for Lucy and Elliot before I say goodbye to you and before we go on to that 30-minute session that will not be recorded? Okay. Okay, Minerva gave you some instructions over in the chat box. If you're wanting to remain on the call and change your name, she's telling you how to do that right there. Very helpful. Thank you, Minerva, for that. Well, if there's no other questions or comments at this time, I'm going to say goodbye and leave you for now. See y'all next week. Lucy and Elliot, thank you for allowing me to be with you today. And I will stop the recording now and say bye-bye.
Thank you, Evelyn, so much for everything.
Glenda.
That's all right, Lucy. Bye-bye.
Thanks so much, Glenda. Bye-bye.
Bye-bye.